All right, welcome to our next webinar of the NAM and the Manufacturing Institute's This Is Our Shot Project Education Series. Before we get started, this is a reminder that this webinar is recorded. And for those who are joining us later, the date of this recording is March 31st, 2021. We'd love to see you on camera, but please do make sure your mics are muted unless we call on you. Also, another point of logistics, we're going to welcome to take your questions. You can put them in the chat feature and we'll try to get through them in the course of this presentation and webinar. But to start things off, one quick survey question. We'd love to know how you're communicating with your employees right now. So I'm Chris Kafalis, Vice President of Brand Strategy at the NAM and lead of the This Is Our Shot project, an initiative of the NAM and the Manufacturing Institute to help manufacturers safeguard their team members, support their communities, and help us all end this pandemic. Now, all of the resources for our project can be found at nam.org/thisisOurShot, where you'll find social media toolkits and other materials to help you as you develop your or refine your vaccine communications policies and practices. We also launched last week the Yellow and Red Ribbon Initiative. It's an initiative to help take one of the most persuasive forces in getting individuals to want to get vaccinated, the persuasive power of seeing other individuals they know get vaccinated, to the next level. And so you can go to the This Is Our Shot landing page to learn more about that initiative today. Now, a major part of our project is bringing together, developing science-based resources for manufacturers to utilize as a part of your vaccinations plan. And there's a pressing need, right? We're hearing and we're seeing eligibility of vaccinations increase all across the country, really at a rapid pace. And so to that end, the Manufacturing Institute has teamed up with experts at the University of Florida Center for Public Interest Communication to develop resources and communication strategies for manufacturers to share the importance of COVID-19 vaccination with workers, families, and communities. And so today we're joined by two experts leading the effort, Anne Christiano and Jack Berry. And so Anne and Jack, I will turn this Zoom over to you to walk us through the do's and don'ts of employer communication.
Terrific. Thank you so much, Chris. It's great to see you all. I'm very excited to share with you today. While we are presenting, I encourage you to add your questions into the chat. If you have examples of some of the principles that we're going to share with you, we'd love to hear about them. Or if you've experimented with some of these ideas and it hasn't gone well, we'd love to hear about that too. We'll have time for discussion at the end, but please do keep adding those comments to the chat and we'll be monitoring that closely and respond as much as we can in time. So I'm Anne Christiano. I'm the director of the Center for Public Interest Communications. I come from a long background of health communication, first working for the Robert Wood Johnson Foundation and then coming to University of Florida. The center that I direct and where Dr. Jack Berry is one of my colleagues, is a place where we use social, behavioral, and cognitive science to address really vexing communications challenges like this one. And so one of the things that we discovered back in August was that there were very few organizations that were pulling peer-reviewed research to see how we could boost vaccine confidence. And so we were asked by the United Nations to do a very quick turnaround on this, our very own Project Warp Speed, to begin to identify some principles that communicators, like so many of you on this call are, could use to help build confidence in the vaccines when they became available. And we are now at a critical moment. As Chris said, the vaccines are becoming widely available. And so people are really at a point where they no longer have to wait. It's time they can get these vaccines easily within their communities. But as employers, you have a great deal of influence and trust with your employees and are well positioned to help build their trust and encourage them to get those vaccines. So let's share with you some of these principles. I want to just start by saying the way that we approached the work and the insights that we're going to share with you today was that we identified the foremost scholars working in this space around the world and brought together 16 of them in a series of conversations over a period of several days, asking them questions like, how can we build this as a social norm? Which emotions should we be using? What are some of the factors that are leading to this lack of trust? And once we had those conversations, we pulled together the principles we'll share with you. We confirmed those principles with the scholars and continue to reinforce these with additional research that we're doing. We also tested them through a survey, and Jack will be sharing some of those results with you today. So I just want to make a point about getting to herd immunity, which we've heard a lot about. And we keep hearing this number of around 75% being herd immunity. But that's not a finish line, because having 75% herd immunity for our entire country doesn't mean, or having 75% of the people get the shot doesn't mean that we've reached herd immunity. It means that we've got herd immunity for specific pockets. But if we have large communities of people who are still saying that they're not getting the vaccine, they are not going to be benefiting from that herd immunity, because they're going to be in communities where people are not safe. So I think it's important to note that that 75% number is not a finish line. It's also important to know that getting people to get the vaccine is fundamentally about trust. Their trust in messengers, their trust in the vaccines, their trust in you, their trust in the organization. So we're going to review today very quickly so that we can have lots of time for questions, 8 principles for how you communicate about this. And let's jump in with the first one, which is really working within people's worldviews, identities, and moral values. And this is about meeting people where they are. This is not a challenge that is going to be solved by sharing information. This is going to be a challenge that's going to be solved by listening and understanding what is most important to the communities that you're trying to reach, and connecting getting the vaccine to what's really important. So our worldviews are that collection of stories and expectations of the world around us. They guide how we think the world works, and they exist along a continuum. It's really important to understand the worldview of the communities that you're trying to reach within your organization to figure out what kinds of messages and solutions are going to resonate, and avoid the ones that are going to lead to information avoidance and perceived threat. So we're going to get a whole lot more specific about that. But then I want to share with you this idea of identities. Identities are the groups we see ourselves belonging to. You could be a Yankee fan, or a union member, or a teacher, or a mom. We all have lots of identities. We self-select them. And within our identity groups, you share specific beliefs and norms. And if an identity is particularly relevant to us, we are going to conform to the behaviors of that identity group. And we're going to be super unlikely to engage in behavior that separates us from the groups that we identify with. So really understanding people's salient identities is critical to all of this. So for example, one of the people who participated in our project, Monica Spana, said, what's going to be compelling for some communities is what resonates with their personal values. So if you are a rugged individualist who believes that you are going to bootstrap your way to success, then really talking about freedom, getting freedom to go back to work and do it safely, the freedom to go back and congregate at your place of worship, and really having individual agency and control, that sort of responsibility to community, to being a good parent, to protect somebody who may not be able to get the vaccine. So what we're really talking about here is figuring out what is most important to the individuals you're trying to reach, and connecting this behavior of choosing to get the vaccine. And really using language like choosing to get the vaccine, making up your mind, really emphasizing that individuals have agency in this space. So our moral values guide our decision-making. They're the basis that gives us the ability to make quick judgments about whether something is good or bad or right or wrong. And they're also the underlying reason for different behaviors across different cultures and different communities. So people have very different various different ideas of what's right and what's wrong. For example, in some of the work that we do around preventing child labor in global context is the idea that in the agriculture sector, some people may say, having children work in the fields is really wrong. But somebody else may say, I worked in the fields as a child and it was critical to me becoming the person that I am. So you could have these very different perspectives of right and wrong around an issue. And these break down too by conservative and liberal values. So you see very different moral values for conservatives and liberals. So with conservatives, you see this deep need for loyalty, for respect for authority, and purity and sanctity, whereas a more liberal value might be protection from harm or fairness. So when you look at this, you can see why some of the messages around doing this for your community or even messages around herd immunity are much more liberal kinds of messages that may not work with more conservative communities. So it's really important to examine these worldviews, identities, and moral values, and really talk about vaccines in the context of what's important to them, whether it's getting back to church, getting back to school groups or family reunions. Really start with an understanding of these moral values, what people see as right and wrong, and create calls to action that are going to resonate with what you've learned about moral values, worldviews, and identities. The next principle is to use timing to your advantage. Now, this is challenging because we're working with a group of people who've really been kind of at the back of the line for their communities. They've had a lot of time to think about this, but recognize that people trust most what they hear first. So it's also true that rumors are born from deep shared curiosity and a lack of information. So if you want to manage rumors within your organization, it's really important that you are sharing updates regularly about what policies are going to be, whether people are going to have time off if they have short-term side effects, whether vaccines, what your policy is going to be about whether vaccines are mandatory. There's a lot of shared curiosity, and it's important that even if you don't have an answer yet, you're communicating the process for how that decision will be made. So a constant stream of information from your organization is really critical. It's also important that you are consistent. The different messengers that are going to be in contact with your communities are all carrying the same messages. What's important about this is that we evaluate everything we hear against the first version of information that we hear. So really understanding the spaces where you can get there first and be the first source of information on a particular topic is really going to encourage people to evaluate messages critically against what you've already told them. So really use timing to your advantage, identify those content areas where you can get there first. Really, and as you make announcements, really think about what else is happening at the same time. Because brains are powerful sense-making machines, and people will draw connections among them that you may not even see yourself. And that can also be a place where misinformation can come from. And it's really important to repeat these messages. Well, it's important to be first. It's also really important that people hear the same message from a variety of trusted sources. So speaking of those trusted sources, it's super important to use the right messengers. Effective messengers are people who are trusted leaders and community experts. So it's worth spending some time figuring out who the trusted messengers are within your organizations. And that doesn't necessarily correlate with title or status. And is really much more about the kinds of people that people feel socially connected to, even in organizations like yours. recognizing that we trust our in-group over our out-group. So our in-group is that circle of people who we really rely on for information. They'll often be people who we share identities with. And when we can work with in-group messengers, some of the scholars who participated in our work said it's like a fast pass to trust and really getting people to shift their behaviors. And it's really important to embrace apolitical sources. And here we're not just talking about elected officials or politicians, but people who may be perceived as having a political role within your organization as well. So Jack wrote and fielded the survey where we tested a lot of these principles. And one of the things that we looked at was trusted messengers. You want to share this, Jack?
Sure, yeah. So as Anne was mentioning, I'm a postdoc with the center and I'm a political economist by training. And we were able to do a survey across 4 countries, the US, the UK, Germany, and France. And we saw very similar results in who the trusted messengers were when we asked about where people were getting advice about the pandemic and also about the vaccine. And as you can see in the chart, pretty far and away, national health professionals, scientists and researchers, and your personal doctor were by far the top scoring categories. And then it fell pretty dramatically after that to friends and family, government and politicians, pharmaceuticals. And then way at the bottom was celebrities. And I don't know about you folks, but I'm not trusting my favorite rock band's advice on the vaccine anytime soon. And also, I just want to mention, Anne, there's a lot of people really providing some great stuff in the chat. And Patricia Donahue mentioned that she's brought in local experts from the medical field to present facts and data and providing a Q&A. So as from this chart, you can tell was probably a need for that.
Such a fantastic idea. You know, one of the things that's important about this chart is that personal doctors have really been left out of this because they don't have the freezers that allow them to store the vaccines, and so they can't administer it. So those really local sources of expertise are critical messengers. So really smart to be doing that. Great. Thanks, Jack.
Yeah, and we just related to that, we also saw that people across the 4 countries also wanted to receive information about the vaccine from people in their community rather than kind of distant experts. So that was definitely an important about who to have as a messenger. And I also want to mention there's a lot of other things in the chat as well, including people doing one-on-ones with their employees.
One-on-ones are so great. One of the things that we continue to see in the research is people's desire to have the opportunity to talk over their fears with a trusted expert, to really feel listened to feel seen, to feel acknowledged for their fears. And those kinds of strategies we've seen organizations really having great success. The other important aspect of individual conversations is that if you've got somebody in your community who is having real concerns, who's taking a lot of time to make up their mind, you want to have conversations with that person in a one-on-one setting so that they're not broadcasting their perspective and creating a perspective within the community that's a normative perspective. So really smart to be doing one-on-one conversations. So understand which sources of information. Once you identify some of the trusted messengers within your communities, really understand what sources of information they're citing. Make sure that those trusted messengers are using really good information, not Dr. Facebook, but going to the CDC and some of these other legitimate sources of expertise. It's also important to recognize that we do have trusted messengers in both offline and digital communities. So really kind of figuring out where both of those are for your communities can really help you create and share those messages that are going to be trusted. Our next principle is to make your content super concrete, supply a narrative, and provide value. So you've heard me say this, I think 5 times already on this call. Information is not going to solve this problem. Simply giving people more information is not going to get them to go from being worried about the vaccine to being certain about getting it. We really have to use concrete language. You know, we saw some real harm done in the early stages of COVID, just around a term like social distancing, which is so abstract and ambiguous. In social distancing, many people did literally socially distance and kind of cut themselves off from other people rather than just stay physically distant, which is a far more concrete perspective. When you've got terms that may be specific to your organization or specific to the policies that you're using, really use the definitions for those terms, recognizing that people have different levels of expertise. And when you talk in definitions rather than scientific terms or terms that may be specific to your expertise, you're going to have a much greater shot at having shared understanding. Really get people, create forums for people to tell their stories of getting their vaccines. Encourage the people who are getting vaccines to share those stories on Facebook. Congratulate people, give people space to tell the story of the experience where you can, because that really helps people make sense of what is happening here. And think about how you can provide value. Understand the things that people are really curious about and worried about, and provide meaningful answers to those questions. And if the answer to the question is we don't know yet, it's perfectly fine to say that, but you have to acknowledge that you are really listening to the concerns and questions that they have. We've seen vaccine hesitant communities use regret, choice, and control really effectively, but we can flip that and say, would you not regret if you had the opportunity to get the vaccine and chose not to and got sick? You have choice about when to get the vaccine, really, using language that talks about people choosing to get the vaccine, making up their minds, and really talking about the control that they are going to regain over their lives. So these are 3 really powerful messages that are available to us to really build confidence. So overcome abstractions with messages that really situate the importance of this in terms of the local threat. If you're saying it's really important that you get vaccinated because we're seeing a spike in our community, or we're concerned that new variants could be particularly harmful to our community, really put that in the terms of a local threat, or even the timeliness that the fact that this week people are continuing to get sick. This week we are continuing to see this variant in our community. Again, flip those themes of choice, regret, and control and frame them in a positive way. Look for messages that you can be consistent about even as the knowledge evolves. One might be the process for creating a vaccine. Another might be how you're going to make choices within your organization about time off for people getting vaccines, or whether a vaccine will be mandatory for different types of work. Find things that you can be consistent about even as the landscape changes. And then really situate the facts within the stories of individuals who are reclaiming control of their lives. That makes them believable and relatable. And the more that you can, I loved, Chris, this example of the Red Ribbon, Yellow Ribbon campaign, really creating space for people to share those stories. That's what makes them believable. That's what makes them relatable. So our next principle is to recognize that communities have different relationships with vaccination. I think there's been a lot of really constructive conversation about this. And some of this is about, obviously, the experience that many Black Americans have had of being marginalized by the medical care system, not just historically, but in real time. But it also relates to things like people's feelings toward authority, their perception that this has become political, or whether the community in which you're working is a loose community that tolerates lots of different kinds of behaviors and perspectives, or a tight one in which people are expected to act very similarly. An example of a tight community might be a military unit, for example, where people are all expected to act, dress, and behave in very similar ways. What's important about this too is that language and metaphor and messages and imagery have different salience within different societies. So materials that are coming out from the CDC may not work in your community if they have a different feeling about authority and may not be trusting the CDC. Something that cites local experts is likely to be far more effective. And that local outreach is so important. And it really comes back to the listening that one of you referenced earlier. For example, with previous vaccines, we've seen communities being worried about whether a vaccine is halal or not. So really listening to it, rather than sort of labeling somebody as vaccine hesitant, understanding the specific reasons for their concerns and being able to address them can be quite powerful. So understand whether the community in which you're communicating is tight or loose. Take into account the relationship people have with authority and frame the message accordingly. As much as possible, you really want to get immersed in the community to understand specific fears and concerns, and also be respectful that particular communities have very significant and valid reasons to be fearful of new medical interventions, and address that transparently. So our next one is to change social norms to gain acceptance. So a social norms approach has you identifying people who are social influencers within your organizations, within your community, those nodes. Famous study by Betsy Pollock that reduced bullying in middle school she surveyed all of the middle school students in New Jersey and asked them who in their school they most enjoyed spending time with. She then triangulated that data, found those young people and trained them in bullying prevention and tolerance techniques, and was in doing that able to reduce bullying in middle schools by 30 to 35%, which is quite powerful. What's important about that study is that the influencers who the young people identified were really different than the influencers that school administrators identified. They actually tried training both groups and found that the interventions where they trained the young people that the students identified were far more effective. So it's really worth it to do your homework to find out who those trusted influencers are within your own organizations and community. And again, that's not going to necessarily be associated with somebody's status or title or the nature of their work. And norms campaigns have been super successful at reducing sexual violence, at reducing binge drinking among college students. We've seen lots of reducing violence between tribes in particular parts of the world. So these norms campaigns can be really, really powerful. And they're powerful because you identify the bright spots, you identify the influencers, and that becomes what you transmit. Now, norms can also work in a harmful way too. So what you wouldn't want to be doing is trumpeting stories of people's concerns or publicizing rates that say, 50% of the people within a particular setting are not planning to get the vaccine, because that could create a perverse norm that would be harder to overcome.
Yeah, and giving some evidence for what Anne's talking about, we saw social norms throughout our survey being very strong, including this question, which asked about whether people wanted a personal choice and whether to get a COVID vaccine. And you can see across the 4 countries, this was a strong, overwhelming response. And that's not surprising because personal choice is a social norm in these Western countries. And actually looking a little more carefully at this data, you can see in the United States, it's even stronger of the social norm than the other countries in particular. And we also had a great comment in the chat from Michelle Cooper, which I'm curious about your thoughts on building a social norm campaign in a manufacturing plant. She said that they post pictures of employees getting their vaccines, voluntary if they wanted to put them up. And they've discovered that people are now excited to get their vaccine so they can have their picture put on the vaccine board.
I love that. I love that so much. And I love too, the sort of authenticity of this. It would be really tempting to stage a photo shoot of a well-liked employee getting their vaccine and make posters of it and stick it up around the walls. But that would not feel authentic. That would feel like propaganda and would probably not be as effective as what you're doing. It's fantastic, fantastic idea. So this idea of social norms can be quite powerful. So really do exactly what you're doing, Michelle. Highlight the people within the social network that are getting the vaccine, not those that aren't. Work with the influencers within your organization to shift those perceptions. And also, it's incumbent upon us as communicators to address a new social norm ourselves and create a social norm around using science-informed frameworks like the one we're talking about today. All right, our next one is to evoke the right emotions. Different emotions invoke different behaviors, and so we have to choose them super carefully. Fear, for example, can elicit mixed reactions. It might make us fight, it might make us freeze, it might cause us to protect people around us. Shame is likely to make people obscure their harmful behaviors. So one of the things we've seen is people saying, oh, I'm sure I don't need the vaccine. I've already had COVID, so I've got the antibodies. So people, trying to shame people into getting the vaccine is just not going to work. But pleasant emotions like pride and joy and parental love and in place of unpleasant ones can be quite powerful. So it is really visceral to want to get people to use shame. And this is something that Neil Lewis, who's one of the participating scholars, who is deeply respected in this age, was like, absolutely, this is a very clear don't. We don't have a lot of don'ts for you today, but this is a very clear one to avoid using shame. But,
yeah, and
yeah, go ahead, Jack.
No, go ahead. I was just going to say, on the flip side, using messages of hope, we found to be very strong across our survey, including it had the strongest response. About 87% of the full sample thought that message, a message of hope, such as one, that vaccines were the best chance we had of ending the pandemic. So 87% of the folks thought that was the case. So a message of hope was strong. But interestingly, this chart in front of you is only of people who are vaccine hesitant. And still, we found 41% of them still responded to this hopeful message that the vaccine was the best chance we had of ending the pandemic. So a hopeful message may work for people who are hesitant.
Thanks, Jack. So avoid using shame, fear, and sadness. We tune out messages that use sadness or shame because we really want to retain our positive sense of self. So really tap into hope, pride, and parental love. Our last principle for you is our perceptions of the motivations of the messenger matter. We have to be hyper transparent about those motivations, even when it seems so obvious. Like, of course you want your employees to be healthy. Of course you want to be able to get back to regular life and the kinds of things we enjoyed in the before times. The funny thing is that you actually have to say it out loud. You have to say, we want you to get the vaccine because we want you to be safe. We want you to be healthy. We cannot afford, we're about to experience a period of profound economic growth. We need every member of our team to be ready and healthy. And I think that sort of optimism and readiness messages could be particularly powerful coming from employers. And we know that from some of the research that one of our participating scholars is doing right now, that employers are deeply trusted in this space. So continue to build on that trust by being hyper transparent and sharing your motivations for this out loud. So these are our 8 principles. We went through them in lightning speed, but I'm going to stop sharing so that we can see you all and respond to questions and observations.
Great, thanks, Anne. And yes, please, let's have some questions. And before we jump in and give folks a little time, we talked right before this call, we're seeing a lot of incentives being given for vaccination, right? What have you seen? What are you seeing in some of the research work that you're doing as it relates to the impact of incentives on encouraging vaccination?
Yeah, it's surprising because incentives seem like a go-to. Like, of course, an incentive would work if you want to give people T-shirts, like I got my vaccine, or gift cards, or other kinds of rewards. But interestingly, for people who are worried, for people who are hesitant, there seems to be a backlash for incentives. So the incentive has to really work with the call to action. So we're doing some work with nursing homes and nursing home workers, which are also surprisingly hesitant. And one of the incentives we're hearing is effective is employers telling their employees, if you have short-term side effects that make it hard for you to get to work and you're worried about missing work, you can take a couple of paid days off. We are fine with that. And that's doing a lot to boost confidence among people who can't afford to take those days off or are worried about taking those days off. But for something that's like, we're going to give you a cash prize or enter you into a raffle, that can really make a suspicious person more suspicious, because then it's sort of like, why would they care about this so much? And so it can really inflame people's concerns. So I would avoid those kinds of incentives. William, I'm seeing your question about allowing those vaccinated to not have to wear masks. I think we should test that. I know a lot of the recommendations are that even people who are vaccinated are still should still be wearing masks until we know that an entire community has gotten the vaccine. So I would be a little bit wary about that, but I could certainly see how that would be very appealing, that wearing masks is, particularly in trying to do manufacturing, could feel like a safety hazard and a particular burden. So Jack, we'll have to add that to we'll have to test that.
Yeah, for sure. And I think that the CDC currently is saying you can hang out with people who have all been vaccinated together, but whether that's the case across the workplace is a little bit unclear.
Yeah.
And that's worth giving us an opportunity. We know, right, that there are a lot of questions that increasing vaccination raises for workplaces, including how to go about operating a break room or other aspects of your enterprise. And so Drew Snyder on our policy team is actually working to bring together a webinar around shared practices and guidance to help manufacturers navigate some of those questions, which we know are pressing and outstanding. Anne, you mentioned research that is underway. Yep. Can you give everyone a little bit of an indication of what's on tap and what you're working on with the Manufacturing Institute?
Yeah, for sure. Thanks, Chris. So we are deeply immersed in research around the specific kinds of people that are working in manufacturing right now to begin to uncover messages and strategies and tools that are going to help you boost vaccine intention within your own communities. So right now, Jack and our colleague Annie Niemand, our Director of Research, are spending a lot of time swimming in the research, identifying scholars. In the next week or so, we are going to bring those scholars together and extract their best ideas that are pulled from research they're doing on these issues right now. We're going to develop messages and strategies that we're going to be testing in a nationally representative survey of people who are working in manufacturing. And we should have that for you very, very soon, with taking many of the principles that we've shared with you today, making them a whole lot more tactical and specific for the communities that you're working in.
No, that's great. And we are very much, we appreciate the partnership and the fact that you have all dove into this work to produce it in a rapid fire way, so that we can get these learnings and intel out to manufacturers across the country. Meg put in a question. What about group incentives? For example, when the employee population reaches 70% vaccinated, we will celebrate in some way. Do you have any thoughts on that approach and whether that might work?
Yeah, I would say that if you're going to use a group incentive, it probably has to be 100%, because otherwise you're still giving people space to opt out, to say somebody else is going to do it. Even if we're at 75%, that still doesn't require me to do it. I have experimented with this in my own classrooms, saying to my students, when every single person completes the class evaluation, I will drop 2 essay questions from the final. And I've tried it with, I don't have any essay questions on the final, by the way. I've tried it with 60%, 80%, and 100%, and it only works at 100%. So, because otherwise people have that wiggle room to say, well, somebody else will do it. Yeah.
So there's a question in the chat as it relates to sort of when we need to reach a level of vaccination and stop wearing masks. I will say this: we will continue providing expertise from CDC and other medical experts to manufacturers to answer those types of questions. We'll steer this to focusing on the communication strategies that can help improve COVID-19 vaccination, but happy to also take any questions that we can send to medical providers that we have access to. You can send those questions to thisisOurShot@nam.org. Does anyone have any other questions?
There is another question that somebody sent me in the chat, which is when we say soon, we should have some useful insights for you within the next couple of weeks based on our scan of the research, and then the survey by the end of the month with the tested messages and strategies. So very soon. I know you need this. We know you need this. So we're working as fast as we can.
No, we really appreciate that. Does anyone have any other questions? Time for one more. If not, again, did I hear someone?
I was just going to say you're welcome to share my contact information if people want to follow up with specific examples. I would love to hear more about these great examples. Or if you have specific questions, I'm happy to do that as well. So please don't hesitate to share my email address.
Yeah, and looks like, the vaccination effort is going strong. Gary, we're doing an on-site vaccination clinic for all employees, hoping to get large participation, and we hope that's the case too. And would love, Gary, for you to share your insight and learnings with us. We want to make sure that we are getting input from you as to what is working, what isn't, as we move forward. So again, use the email. This is our shot@nam.org, and we can funnel those information and inputs. So. And Jack, thank you for joining us. We appreciate the opportunity to work with you, but also your concise, precise knowledge today. We will actually, after this concludes, we'll send this presentation and the presentation that Ann and Jack prepared for everyone so you can utilize with your teams. We will continue having other educational webinars like this. And as Ann said, soon, we will have more learnings and communication toolkits that could help you with your employees navigate some of the challenges that we're all facing. So I want to thank everyone for joining us. Again, Ann, Jack, thank you. This concludes this webinar. Thanks, everyone.
Thanks, everybody.
Thanks.